Joining me now, Larry Shackelford. He's the CEO of Washington Regional Health System in Northwest Arkansas, and always good to catch up with him and get his take. Larry, thank you for being with us.
Well, thank you, Robbie. Always good to have a chance to visit.
All right. One of the things that I want to get right off at the top here is Washington Regional has been reaccredited as a level two trauma center, the only one in the region. I want you to tell me what that means and why is that important?
Yeah. So in Arkansas, all trauma centers are designated by Arkansas. Level one is the highest level. Washington Regional was just accredited as a level two, which is the second highest level. We serve about 26 counties in Arkansas and are the only level two in that area. There's level two in Little Rock and one in Hot Springs, and that's it from an Arkansas standpoint. So, I think any of us, our friends or family, can be impacted by trauma at any time. So, we think it's really great to have access here in Northwest Arkansas and to be able to provide that very high level of trauma care.
All right. Well, congratulations on
Thank
that.
you.
Let's talk a little bit bigger healthcare picture here. I know that you're deeply involved in watching what happens in Washington, D.C., as well as at the Arkansas State Capitol. But let's start with federal policy first. Kind of give me an assessment of what the state of healthcare is in this country and maybe as it pertains to Washington Regional.
Yes, sir. Well, I think it's clear to everybody from the outside looking in is the state of healthcare at the federal level is in a bit of flux right now. We definitely have new leadership that is in place. Obviously, one of the big challenges is healthcare financing. There's talks and discussions about how to cut 1.5 to $2 trillion over the next 10 years. And the president's agenda calls for 880 billion of cuts from both energy and the healthcare sector. At the same time, there's promises to not cut Medicare or Medicaid benefits, a lot of discussion around Medicaid cost and how to manage that. The federal government pays a disproportionate share of Medicaid cost. And so, that's something we're certainly keeping our eye on. There's talk about rolling back that federal share, which is 90% now, to something I've read as low as 50 to 75%. Talk of limiting Medicaid expansion, talk of adding work requirements at a national level. So I think I would characterize it being really challenging to do long-term planning, and I think everyone is just kind of taking a wait and see uh, approach.
What you mentioned that Medicaid expansion, that change in the funding formula from 90/10 to something much different than it is now. It would mean that the states would have to pick up the additional tab on that if they chose to do so. They could also fold the tent and pack up Medicaid expansion if they wanted to. At the state level, when you're talking to some of the legislators at the Capitol, do you get any greater clarity in terms of where you think things might go policy wise in Arkansas as it relates to Medicaid and healthcare financing?
Yeah, well, obviously, since a large share of the federal trickles down to the state, I think we're kind of hearing that same thing. Maybe some of the original expectations around Medicaid modernization may be on hold, just waiting to see what happens with those federal funding. Uh, was encouraged, however, Senator Missy Irvin introduced Senate Bill 527 last week that would extend the Medicaid, you know, expansion, which is a really big deal. Um, you know, some of the things in that language. There are pharmacy rebates the state's not capturing that would change if this passed. The medical loss ratio has historically been 80/20. This legislation would take it to 90/10. As the governor has anticipated and asked, there would be a work requirement that would be added to that. So, we have seen in Arkansas the number of uninsured dramatically decrease with Medicaid expansion. It's something that's very important, and so that's a bill we've got our eye on, that hopefully they can get across the finish line in the last couple of weeks of session.
We'll be pulling for them to do that, Larry, I promise you.
Absolutely.
Tell me what has passed already in this legislative session. Dr. Lee Johnson has pushed a variety of bills. There was obviously the big maternal health package that got through several weeks ago. What else? What has happened already that you view as beneficial to hospitals and healthcare financing?
Yes, as you mentioned, the Healthy Mom, Healthy Babies Act was a really big deal. And the fact that this will allow Medicaid to reimburse providers for prenatal de delivery and postpartum, uh, allow them to be presumed to have coverage while they're going through that application process. There were some pretty significant reimbursement changes. Arkansas really trailed. So I think this is probably one of the top things to come out of the session, for sure. One of the things at Washington Regional we're very excited about is the graduate medical education program.
Right.
Washington Regional, UAMS, and Mercy were approved for some funds to start new residency programs. Washington Regional, that's going to allow us to have 78 residency slots over the next 5 years or so. We've seen the number of medical schools increase, the number of medical students finishing and having residencies in Arkansas is a really, really big deal.
Yeah, there's a lot of statistical evidence that where you do your residency is where you wind up staying. And then, of course, in Northwest Arkansas, there's such huge population growth that the needs are going to be tremendous in the coming years. As we look to kind of last question for you here, and we may have touched on this already, but I want to give you a chance to either express it again or bring up something we haven't discussed. What's kind of the biggest concern for you out on the horizon? What needs to still be addressed either at the state or the federal level that if you could wave a magic wand, it would certainly make your life as CEO a lot easier.
Well, that would be nice. There are kind of three areas that are top of mind. I think for me, one is healthcare workforce, and we have seen as you mentioned in Northwest Arkansas, the area grow. We need more healthcare workers. Talked earlier about training more doctors, which is a great thing, but we also need to train nurses, and we need to train lab and imaging and therapies. And so, those providers are at the top of the spear, but it really does take a village. And we've really seen in the post-pandemic workforce or the post-pandemic timeframe impact on workforce. So what we're trying to do is to grow that pipeline and create and attract more workers. We have talked about healthcare financing and the math problem that we have. Part of what makes it hard in Arkansas is our reimbursement is so low, the lowest in the nation. But you combine that, I read here recently a study that Washington and Benton counties were two of the healthiest counties in Arkansas. And that's not the case for Arkansas as a whole. And in fact, you don't have to get very far from the I-49 corridor, and it's not so. So how do we balance healthcare affordability to give the coverage that we need, but be able to solve this math problem? And I think ultimately what we're going to have to get our hands around is how are we investing in the right things? And are we getting the kinds of results? Do we have a system that's designed to keep patients well and not one that's just designed to fix them when they get sick?
Yeah. All right, he's Larry Shackelford. He's the CEO of the Washington Regional Health System. Appreciate your insight on this. Very, very helpful to understand the situation on the ground. I wish you the best of luck and please keep us posted.
Thank you, sir.